So, dear colleagues, ladies and gentlemen, good afternoon once more, and let's applause to those who are here. Dear guests, round of applause to you once more. Before we start our next session for the nursery in dentist care, I'm afraid only of dentists and darkness. So let's clear about dentists, about dark. Just imagine how many dentists can be in dark. It's no joke. Everybody remembers that. Everybody knows that and loves it. In any case, many of you, as me, as many others, visitors, guests of our assembly, were afraid of dentists in their childhood. But you are among those people who, regardless of childish fears, connected their lives with this profession and help people not only to be healthy, but to smile widely and nicely. And we will speak about that in a broader manner, and I think it refers to each and every one of us, and will refer not only to us, but to the patients who will definitely visit us in a few days. As I've already said, the next session is about nursery in dental care. Here are the moderators now. The main nurse of dental clinic number 6, Department of Healthcare of Moscow, Елена Kazhevnikova. Елена, please take your seat. Head of the Medical College number 5, Natalia Grebneva. Round of applause to Natalia. Please take your seat. And on this stage, we see one of the representatives of the male nurses, who are quite few. There is certain disbalance, gender disbalance in this profession. The main nurse of clinics number 9, Marat Akhmetov. Round of applause to him and welcome him, please. I see that Marat Akhmetov is loved by the audience. It's really nice. So, ladies and gentlemen, I wish you a very nice session and good day to you, good day to our moderators, all the best to you, and let's begin our session. Right now, you have the floor. Good day, dear colleagues. Before we begin our session, I would like to say that for the first time on this level, on this scale, we represent the functionality of dental techniques, of dental nurses and dentists. I'm glad to welcome you at our session, and I think it's time to begin. So let me invite the doctor, candidate of medical science, Martanov Ayaz, with the report. Take care of your teeth, prevention, how often you should attend a doctor, and mouth sanitation. Good day, dear colleagues. Good day, dear listeners. Today I would like to speak about a topic which refers to each and every one of us, absolutely every one of us. That's prevention, and how often you should attend the dentist's cabinet, and how should you deal with sanitation of your mouth. Now we have to discuss a problem which each and every one of us faces. Sooner or later you come to the dentist and his buzzer, metallic buzzer with disgusting sound. What's the problem, and can we avoid it? Because in the list of most unpleasant creatures worldwide, dentists are number 1. So let's figure it out point after point. What's the problem of the caries and this spreadness? A healthy person has it as in a small, slow person. Bacteria can hardly go through the surface and damage the tooth. And the nature of a human being. Caries is a problem where not every one of us is ready to attend a dentist's cabinet twice a year and do not repair it before the tooth is broken. Everybody knows, and everybody knows the situation. It looks like everything is fine, and you see a hole in a tooth, and then goes the second one and the third one at the dentist. You say that everything was fine, and then it began. Especially, it refers to the pregnant ones. Why does it happen so? Holes, unexpected holes, is defined that dentine is softer than the surface. When caries has destroyed dentine to the extent that the surface loses ground and it breaks, the animal breaks. And if it happened in one tooth, there's high level of probability that the others have the same. When you go into the red line, you have to start to have troubles with teeth monitoring. Now, this all starts from childhood. The child is not explained how children have to do what you actually not understand yourself. What is a caries of teeth? That's an infectious disease which is developed due to acids which produce bacteria on the hard tissue of the tooth. We're told do not eat a lot of sugar, the teeth will not hurt, but sugar is under the tip of the iceberg. Every product which has high chemical indexes, like fried potato, white bread, but the plaque is really dangerous because it's a good environment for bacteria. There will be periodontal troubles. You cannot avoid visiting the dentist. Periodontal diseases can be caused with zoonotrophical periodontosis. Mineralization of plaque can be attached to the teeth, and this can influence the gums, and it can provoke. The prevention includes personal hygiene and visiting the dentist twice a year. You should clean your teeth twice a year, and discipline is really important. If parents miss this point of education, and your child will visit the doctor very often. How can you bring up children? I cannot give advice, but they copy parents' behavior. Start from yourself, and the child will copy you and do the same. The picture belongs to a young person who was mature to understand that his teeth is not as good, as smooth as he wants to. 20 years before, he didn't have necessary understanding that cleaning teeth is really important, and it came time that he cannot smile normally, and he has to communicate. Girl, and he does not. They do not love rotten teeth. Seat belts is really important in the car, and personal hygiene is important for that. And cleaning teeth twice a day is really important. Disciplined cleaning of teeth twice a day will help to remove the caries. What brush should you select? A very often asked question. Why do we do so? Because we are looking for the problems in doctors, not in us. Like the water is bad, the toothpaste is bad, the brush is bad. As for the toothbrushes should be changed every 3 or 4 months. You can be assisted by a dentist whether you should take a hard one or medium one, a soft one. Here you can see the areas which should be paid special attention while cleaning teeth. These are side surfaces, natural cavities, and molars. There is a soft plaque, which is a good environment for bacteria. Floss and irrigators are helping a lot, and strengthen gels. Floss and irrigators can be used to clean teeth between the teeth, one of the areas of development of caries. They should be used with special accuracy, otherwise you can damage it. You should not floss your gum accurately, carefully, not to damage it. Irrigator should be used 2 or 3 times a day, and 2 or 3 days if you have gum problems. It also cleans and massages the gums, increasing blood flow, which reduces the process of development of destructive processes of periodont, which is the prophylaxis of periodontosis. Irrigators can be both for washes. Mouthwash can be for fresh, for antiseptic, containing some mineral additives. If you can buy the first and use as you want, the second and third should be used only on recommendation of a dentist. Do not use any medical substances without advice of dentists. Strengthening gels is the same. Damages of teeth can develop not only when there's a shortage of certain minerals, but if there is ample minerals. The body has a very fine tuning which should not be interfered. And closing the link of it is so-called pillow, safety pillow. The dentist can save your tooth when it's harmful, but it's really important that the car of your health would never be brought to the condition when you have to turn to the plumber. So if the dentist dentist will tell you the area which you have to pay special attention to, will correct the skill of cleaning teeth if you have to, will recommend a toothbrush which would be preferable to you. If there is need, he will hold strengthening therapy with certain gels or mouthwashes you can use at home. Will define teeth where they have caries in early stages, and will have professional hygiene. Out of personal experience, if your dentist is not a dentist on recommendation or you are not his old patient, the best check can be done from 2 or 3 dentists. It can minimize mistakes. One head is good, 3 are better. From my practice, recently I had a patient who's 30 years old, and he never attended the dentist, and he never had problems. And now his teeth started breaking one after another. It's once more proofs that you should attend dentist even if nothing troubles you. And finally, what did we figure out for ourselves? The first and the most important is personal hygiene. Which should be no exception, as your teeth, which are created by nature. Perfect created as nature, but gave us brain which ruins something sometimes. The second is attending the dentist at least twice a year to control what you're doing. Third is bringing up your children. Be an example for them. Do not shout them or force them. You should be an example. And as it's said in old rephrasing saying, keep your teeth fine till they are fine. So, attending a dentist, a doctor is a head. The nurse is the neck. If the nurse directs the dentist correctly, if she creates a beneficial environment in the cabinet, the patients will come to us happy, joyful. I tell it all because I see it myself. The nurse plays really big role in the cabinet, and the assistants as well. They are helping the doctor. The second one is the nurse is a person who has children, who has husband, family, and neighbors. And if every one of us, at least 5 people, be turned in correctly, we'll have hundreds of people who are free from caries. Thank you for your attention. Dear colleagues, somebody has questions? Good afternoon. I want to ask you something. The healthcare department of Moscow has ended the training of doctors. Senior doctors and senior nurses were trained in Seoul, South Korea. And people brush their teeth almost every meal. What do you think? Is it correct? Let's go into the extreme. After every meal using a brush, he brushes teeth fanatically, and it led to brushing off the animal. Twice a day is quite sufficient. You should do it correctly. It doesn't really matter what kind of toothpaste. The main thing is skill. Find correct areas where you find the most animal. Irrigators, flossers can help you to do it normally. Don't go to the extreme. Americans do the same. They breath in their teeth like for 40 minutes. There's no need in doing so. Thank you, yes. We invite the senior dentist of the clinic's number 9, Isayko Sergey. And he will make a report how the system and the technology of the 21st century. Of prosthetics of teeth. Good day, dear colleagues. I will tell you about CAD/CAM system. This is the technology of the 21st century. CAD/CAM is computer-assisted design and computer-aided manufacturing. That's modern technology of making prosthetics with the help of computer modeling and cold processing with digitalized equipment to create extremely precise prosthetics. The phases, the initial material is the mold. Then the mold goes to the technician who creates a model. Then this model is disassembled and the scan of the model is performed. Scanners can be both based on laser or on contact. After developing and scanning the model, we receive a digital 3D model, which will be the sample, the basis for cutting the initial part. Editing the digital 3D model is done manually. The technician is editing it manually because the scanned model cannot be perfect, and the technician will find some faults which should be avoided in order not to avoid it with diamond drills and so on and so forth. Our dental technology laboratory uses CAD/CAM technology of the company Willand. This is a laser scanner, a laser cutter. Willand is the technology which is used in prosthetics to create the prosthetics from dioxide zirconium. Zircon is a mineral which is widely used in industrial jewelry. And dioxide of zirconium is ultra-strong material of white color which has unique properties, is ideal to be used for prosthetics in teeth. Here you can have the phases of evolution. For many years, dentists were trying to find the most robust and safe materials to restore teeth, and zirconium meet the requirements. On this picture you can see the first bridge made of cobalt and chrome with ceramic surface, then on the golden welding mold and covered with ceramics. Zirconium covered with ceramics. The advantages of and unique properties will be described on the following slides. Zirconium O2 is absolutely compatible with body, as it's not toxic, does not provoke cancer, hypoallergenic, and does not provoke inflammation. It is good for health and safe for health, as it does not include any materials which can provoke problems with health. It is safe for your health, as it is used for over 50 years in medicine to create joints, artificial joints. Also, it is not thermal transparent. It is perfect for, you should not depulp it before you perform the actions for that. It does not transmit heat. That's why it is perfect for implantation, for prosthetics. They have natural transparency, these crowns, this coronal crown. And on the second picture is the metal ceramics, and on these pictures you can see how the light is going through this metal and ceramic prosthetics, as there is metal inside there and the light is not going through. And if you put it in the UV light, you will see the metal ceramic prosthetics, you will see the core of it, which will not be seen in zirconium O2. which is transparent and will look aesthetically even in ultraviolet. It is stronger than metal and twice as light, as you can see on these images. On the first picture you can see the metal bases, and on the right you can see zirconium ones. In production of this basis, human factor is reduced to a minimum, as everything is done using computer technologies. Here you can see the preciseness of cutting and processing it. In the first picture you can see regular metal carcasses, which is on the second one is processed in the cutter by company Villain. On this slide we perform the scanning. On picture 1 you can see a fixed model of the mold which is put into the scanner. In picture 2 we select the area of scanning of the model what is to be scanned to receive a 3D model later on. Picture 3 is done by fragmentation way. Each part is scanned separately for a more precise scanning. In picture 1 we see the already scanned model, and here we select the tooth. On the picture 2 we make the modeling of our future cap. After scanning and modeling the cap, we go into the cutting of the carcasses. On picture 1 we put on picture 2 we select the disc where to cut our crown from. On picture 3 you can see the cutter where the disc is installed already, out of which the crown will be cut from. After cutting the crown and is polished, then sinterization and baking process is performed. On the picture 1 you can see the oven for baking. On picture 2 you can see the oven for sintering. And on picture 3 it is on the model. The process is quite long. It takes around 12 hours. The crown is being burned in the temperature 1550 centigrades. It's really comfortable for the technician. He can cut it all day long and put it in the oven, and they will be sinterized overnight. On picture 1 we apply dentin mass. On picture 2 the animal cutting edge. On the third one we have the baked crown. On the picture 4 the crown is polished, which will be put into the mouth.
And these are the ready crowns. White part. And figure number 2 is a ceramic. Dental bridges look like that, and the system of CAD/CAM allow us to speed up with restoration, maintaining the qualities and the characteristics of the materials used. Thank you for your attention. Are there questions? There are no questions. I will ask you one question, Sergey. The period of manufacturing of the crown on CAD/CAM system, how much time does it have? Does it take less time than manually? Of course, less time. Less time because less personnel is involved. One technician could make the crown from the very beginning. You don't need to do the casting for provide the metal framework. Yeah, it's less time intensive. I would like to give the floor to the senior nurse, Elena Kожевnikova, dental clinic number 60. She will tell us about organization of work of nurses in dental clinic, functions of nurse in dental clinics. Good afternoon, dear colleagues. I would like to present you a report which is dedicated to a very important topic. Functions of a nurse, not only in dental clinic but in general. My colleague on the previous section asked a question about conflicts and conflict patients. I would like to tell you how it happens in our dental clinic. Our clinics was founded in 1993. It has therapy department, orthopedy department, laboratory, and X-ray and radio examination. 143 employees. Among them, the nursery staff is 57 people. Among them, only 10 have highest qualification category. Nobody has categories number 1 and number 2, but we'll work on that. Our dental clinic, as other clinics, monitors the complaints from the patients, and having analyzed the complaints for the period of 2018-2019, we realized that 80% of complaints are the same time complaints. Even before the patient sits into the chair, a complaint takes place. We started analyzing that and investigating and realized that it happens because of the fact that the patient comes with the very aggressive moods. The nurse did not understand something. There was a misunderstanding between them, and as a result we have a conflict. And by that, administration of the hospital decided to provide unified algorithm for a nurse which reflects almost all her steps from the moment she takes the list of the clinic with description of her functions when she enters the room, provides the list, helps a patient not to wait for a long time, explain there in a polite form, which is a very good wording, if the reception is delayed. Algorithm was fine, everything was great, especially these words in a polite form. You know, everything is very polite, everything is nice, but is not polite. This thank you was said that poor patient, which is afraid of a dentist and sitting in the chair, sign it please, do it please, and this please doesn't sound like a real please, and we realize that we are making a mistake. Our medical staff doesn't know what polite means. They have no idea how to resolve a conflict situation, how to answer a question, what to say, what to do. They just got lost in that algorithm. In order to understand the second part of my presentation, I would like to remind you the theory of conflictology. The majority of all the conflicts take place not because the participants wanted it, because the conflictogen words are said. All these conflictogen words can be divided into 5 groups. Number 1 is striving for perfection. Number 2 is aggressive approach, egoism, violation of rules, and some coincidences, unfavorable. I would expand on the first 2 because they are the most often root key of our conflicts. Number 1, perfection. It means that you should be higher, better than your counterpart. It can be a menace, it can be an order, it can be a remark or something else which is negative. And also, please calm down if you don't understand the feeling of a indulgence. And the aggressive behavior which often takes place as a response to the conflictogenic worried. If a patient misunderstood something, it's also psychological protection mechanism, which means to control the situation by aggression. What shall we do in order to avoid these conflicts, in order to avoid misunderstanding? The first thing you need to understand, first rule of non-conflict communication. Control of people starts with self-control. Lev Tolstoy said that something that is in beginning in a bad mood ends with a shame. Please do not answer with conflict words to conflict words. I told you about that. Please feel empathy. Please feel patience, because it's not a pressure measuring. It's a dentistry. He doesn't know where to go. Somebody's been rude to him. You should eliminate these factors. You should be aware that they exist.
Что мы сделали? Что мы сделали для решения?
How we decided to resolve this issue? We, administration of the clinic, developed a standard of welcoming when communicating the patient. Communication standards includes the welcoming greetings. Nurse knows how to say good afternoon, say hello, what to say, 1, 2, 3, and the standards of a conversation with the patient, standards of exiting the too long conversation, and the standards of communication with aggressive patients. And we introduced algorithm of actions when a patient is aggressive. Great, everything is clear, everything is very obvious, and we provided the wording modules for nurses who doesn't know what to say. This module is a standard as in an airplane. Hello, dear passengers, you smile, you know what to do. These are the normative documents. They have very good effects. I have some time. I would like to articulate what is a conflict avoidance policy. First of all, please listen to the patient. He's aggressive not because of you, because he doesn't have anybody else to tell about, because the patient is afraid. Even the presenter was afraid, and the most frightening doctor is the dentist. You should say, we understand you, it's very important for us, and we will solve your problem in order to avoid these conflicts or these problems in the future. Please agree with the patient. Explain that the situation is like that. The reception was delayed. Why? What is the reason? What is another conflict-provoking words or if events, factors? It's lack of information. The patient doesn't know why he sits in front of your door, not inside the room.
Пожалуйста, в ситуации то, что нужно сделать в первую очередь, а что можно отложить.
You should understand what should be done the first and what should be delayed. If it's too bad, the situation goes too bad, you should go to the head of the department, you should go to the administrator, but never end your conversation just turning around with your back. You should say that, my apologies, I would like to involve more competent person to solve your problem, and also our algorithm has some forbidden actions. For example, to dispute with patients, to shout and to offend, to ignore complaints, to interrupt, to stop the conversation with the patient, everything which provokes conflict situations and conflict conversation. Dear colleagues, and I would like to finish my report with the fact that I hope that our patients are also here and dental nurses are also here. Let us understand each other. Let us learn how to communicate. It's my third day on this assembly. Yesterday I listened to the report that our patients come and they are afraid. They know the doctor will tell something wrong. They are stressed. And our nurses, what do they tell us? They say that these patients are so angry, they come angry and aggressive. Let us treat each other like a human being. In this case, we will not conflict and everything will go better. We love you, we appreciate you, we know that it's very difficult for you. Thank you very much for your efforts and thank you for your attention. Questions, dear colleagues? Tell us, please. What about the staff, the human resources? I shall confess that we have a human resource rotation. Yes, our employees change often. It's a very good question. Thank you very much for that. What is the reason? Young specialists from medical colleges come to us, and the reason is that they don't know what is dentistry, and they came just because they could not go to surgery. It's too frightening. Intensive care is terrible. So probably I shall go to dentistry. It's not. There is no blood there. Nothing frightening, and some girls just left because they said it's boring. You need a basis for the students where they will come and understand what dentistry is, what is the work of nurse in dentistry, and then not to try to find yourself running around the clinics. You know, dentistry does not provide orders. This question was not asked by chance. We cooperate with Marat, and you know that he was organizing a meeting of nurses, and only few of them agreed to sign an agreement with our college. That is why, you know, the nurses are responsible for this problem with human resources. If you want to grow, if you want to bring up human resources, you should do that. Dentistry is something that is not known, and children do not know about that, and unfortunately it's very complicated to talk to them when they cannot see the real work in dental clinics. That is why they do not choose dentistry, and you say that they come there only because dentistry is what's left. I invite you to work together, to join our efforts. It's our common problem, which we can overcome together. Other questions? Dear colleagues, other question. Who developed the algorithms and the wording modules? Administration? Your nurses or third parties? The basic was conflictology as a science. We learned it. We had we had advice of psychologists, read literature, and the most appropriate option to our point of view, which could be applied to adopted to our clinic, was the basis. You yourself, I mean nurses, yes, senior nurse, deputy head doctor, and head of department, of course, it was our joint efforts. And the employees, did they participate? You decided to train them? No, we did not train them. It's a local normative act, local decree, and within the framework, it was done by administration of the clinic. Yes, that's correct. We developed them and we implemented them, just taking the basis of professional sources, professional literature. Thank you. Good afternoon. Senior nurse from Konchalovsky Clinic, Zelenograd City. You developed this algorithm, these wording modules, but nurses, from psychological point of view, they are also tired of communication. How do you provide the unloading and the labor regime. No. Dental clinic nurse works by shifts, first shift, second shift. When she studies that or when she applies that, implements. What do you mean unloading? I mean that communication with clients, an algorithm. She has an algorithm. She smiles all the day long. She says the same phrases all the day. Hello, please come, welcome. You say that you have step-by-step instruction how they should behave. We all are living creatures. It's not always then we can't find a synonym to our word. How, from psychological point of view, how do the nurse feel? Psychologically, they say thank you very much and they feel better now. You don't have schools or something else? No, thank you. Thank you. I would like to give the floor to Mariana Samoilova, candidate for medical science, dentist, orthopedist of dental clinic number 60, preference orthopedy assistants, and the role of nurse at the orthopedy. Good afternoon, dear colleagues. My subject is provision of preferences. Presence and quality of tooth is a factor which influences the life expectancy of the human, and our adult population is has many dental diseases, which is related with the changes of jaw, and periodontics needs to be cured. It is for 95% patients with absence of a number of teeth or all the teeth. And with aging, this trend's increasing. Some residents are provided with a preference. The oral cavity depends on psychological and hereditary factors. They have many problems with health, that is why the oral cavity is not a focus of their attention. Presents for them, they usually have chronic diseases which can lead to the limitation of capacity of taking care of the oral cavity, and it leads to some diseases. In 2013-2016, the expenses on dentistry assistance decreased by 5.3%, and the average 25.3% average payment per ambulatory assistance increased by 5.3%, higher than the basic threshold. The number of preferential medical services is provided. Who can have these preferences? Disabled people, veterans of the Second World War, this and other types of preferential categories of residents. They are subsidized by the government, by the local government authorities. Regional specific features, I recommend you to clarify this question in the local administration. Usually, the preferences are provided to the people whose average income is lower than the minimal established. Retired people, retired military specialists.
И Российской Федерации. Репрессированные.
And repressed people.
От 23 ноября.
According to the law of Moscow, those mothers who gave birth and raised 5 and more children have free cure, and except those which are done of zirconium. The constructions which you can have are prosthetics, metal plastics, made of metal plastics, buccal prosthetics. Thanks to the materials, the patients are provided quality constructions which serve for a long time. The specific programs are not covering the preferential as implantation, then crowns, and prosthetics made of precious metals like gold, splintage, and the others. The thing is that the lines, there is no line for that. In professional thinking of the doctors of any specialization, the duty and proper is extremely important. And the society interest is standing above. In the particularity of this ethics, the doctor has to hold the highest medical standards. The doctor and the doctor should not influence the professional decision, which should be taken only in the interest of the patient. Respect to the human honor of the honor of a human being should be there. They should be faithful with the relations with patients and fight those of the colleagues who show incompetence and probably are fraudulent. Medical ethics should not include self-advertisement, payment of commission for sending patient to him, or any other reward for sending a person to a specific medical organization. There should be rights respected and preserve medical secret. Doctor and the nurse have to be especially specific, giving information about new technologies, discoveries through unexamined or unchecked channels. The doctor has to approve only what was approved, what was checked personally. As for the elderly people, qualification plays a really important role. First of all, it's a respectful attitude of a doctor to the patient. Being punctual, being specific, and providing services in the terms and conditions which were agreed upon with the doctor. The patient should agree with following the recommendations. Good understanding, good spirits, and attentiveness is important with elderly people. And the doctor has to prevent about possible complexities. Those patients who have dryness, who have bone deformation, require more often consideration. What are the particularities? Many patients take different medicines which can influence tissues of the mouth. Some of them can provoke growth of gum, diabetical and the metal is also playing an important role in making the construction, because if some of them are allergic to some materials, they have to have a special approach. So in planning dental interference, you have to bear in mind the age of the patient, his mouth condition, his physical and psychological health and mobility. Very often you have to go to compromises in finding methods of cure, bearing in mind the general condition of a human being. The elderly people have to protect general sanity of mouth, aesthetics, functionality, and capacity to talk. The nurse is assistant to the dentist very quite often to achieve the optimal result in cure. The particularities of providing that at home. The federal laws prescribe for certain groups of population of Russia, of this country, to mount the prosthetics at home. with favorable conditions or who are considered handicapped because sometimes having chronic disease, the teeth are being damaged quite rapidly. That's why prosthetics are really important. First, the handicaps for children with handicaps, disableness, and those who were enlisted, the pensioners who were enlisted before 2005, liquidators of Chernobyl disaster, policemen, and civil servants, which is performed by state dental clinics. Working with these clinics, who very often have no chance to, who are not very mobile, they have to understand the construction and the features of the construction, has to be especially careful with selecting the prosthetics. And remove the prosthetics which can be removed are preferable for the elderly people. It has to be performed especially carefully if the patient is not mobile. A nurse's help is needed, which is playing an extreme role. The prosthetics have to be of high quality, should be easily mountable and dismountable. Recommendations on taking care on the prosthetics has to be explained by the doctor both to the patient and to his relatives and to the one who is taking care. Correction should be done in the prescribed terms, and if it is requested many times, then prophylactics and prevention should be performed once in 6 months. So, the final conclusion for the positive result and finding privileged medical assistance is mutual respect of a doctor and a nurse and a patient, informing of the patient about future construction, providing quality cure and cooperation between the doctor and the nurse, performing all the manipulations of a doctor and the nurse with extreme care, especially if there are problems with the mobility of the patients, and performing all the recommendations by the patient which were given by the doctor or the nurse. Thank you so much for your attention. Dear colleagues, do you have any questions? No questions. Thank you, Mariana. Thank you. Child dentist of the Child Dental Clinic, dental doctor of the State Vegetarian Institution of Health Children Dental Clinic number 52 of the Department of Health of the City of Moscow, with triad of relations, doctor, patient, and a parent. The first attendance, the first visit to the dentist. Hello, dear colleagues. Today I would like to speak with you about the most relevant thing in our profession. Cooperation of a dentist with a child and with their parents is a problem which is relevant not only for young but for experienced doctors as well. A child as a patient supposes close cooperation uniting the child, his parents, and the doctor. The child, the parent, and the doctor is interconnected. This triad cannot be disassembled. Only this cooperation based on responsibility, trust, can lead to positive results. Visiting new places, child can feel fear but curiosity as well. The child has to feel comfortable to the maximum, not to make it too stressful. Select comfortable time for the child to sleep sufficiently, to be well fed, and to be in good spirits. And psychological comfort of small children is directly connected to the physical comfort. The first visit to the clinic has to be liked. He has to like everything. The order, the flowers, this clean aquarium, the environment creates trust both from child and his parents. It is really important to meet the patient friendly, openly. Then they think that they have got to the right place. You have to do everything possible to accept the child as soon as possible. Waiting on its own, especially after a certain time, provokes unpleasant sensations, especially among children. Children communicate next to the cabinet and exchange their impression. That's why you have to organize it the way that there will be no many children next to the door. It is well known that most young children do not like white color of doctors. That's why they wear colored uniform. During the first preventive visits, I show the water fountain, how to raise or put down the hair dryer, the chair movement. I perform almost every manipulation which we do while providing dental care. As a result, this adaptation is going really nice, and children are going gladly to next visits. As for the parents, we can discuss the issue of their presence during the dental procedures. Children younger than 3 or 4 absolutely need the presence of their children. Preschool want their children to be with them. The young school wants to be with parents. Without parents, youngsters prefer, or teenagers prefer to do it on their own. What should we do if they come for the first time when it already hurts? The goal of the doctor is not only to increase the healthcare, but also to form a positive attitude. The doctor tells to the child and to the parents of the manipulations which will be done, on the impressions, on some nuisances which can accompany that. Maybe it will hurt a little bit or a lot, and the child will help a lot if he behaves well. That is how doctor prepares this necessary level of communication. It is really important to gain trust. In order to establish psychological contact with the child, the doctor has to bear in mind a few factors: the age of the child, its intellectual development, his emotional condition, temper, behavior of the child during the visit to the dentist, and type of attitude of the parents. We can forecast how the child will behave in the chair, but how he will behave in fact, we never know. There are rules of communicating with children. One have to demonstrate sincere attention to the needs of children, demonstrate a model of non-aggressive behavior, allowed to show anger in some situation, constantly provide support, form capacity to trust and to compassionate. Distract child with playing situation if there is an outburst to come. A doctor and a nurse have to always be friendly, even if the child is aggressive, and not only the child. And once more, my personal experience, we are in constant game. We are going to the snowflakes, not making injections. We are sucking with a magic hoover the worms which live in the teeth. We give them certificates, we give them souvenirs, water balloons, presents. People love it. The children love it. Very important role in children's behavior is played by the parents. They have to feel that doctor is sincere and open in his emotions. Should be demonstrated with the context of the parents of a young patient. Our goal is to consider not only the physical condition of the patient, his psychological condition, but also the psychological condition of the parents. There are various types of parental behavior. An ignorant parent who pushes his child to the cabinet, gives him to you, and walks away, and doesn't care what you do with him. Aggressive parents are behaving aggressively towards medical personnel. Angry person who is angry against everybody. Made of plaster. His attitude can change immediately due to basically no reason. Moralizing parent is extremely suspicious, does not trust anyone, sees threats to the child everywhere posing. Parent, depending on the situation, takes these or that types. Relaxing parent is the best type of parent who treats medical instructions with care and understanding. It helps a lot. We have to put trust into the hearts of the parents with flawless behavior. We have to learn zero conflict communication with the parents of the children. There are two types of zero conflict communication. Do not lead it to the conflict. And program yourself for non-conflict communication with the parents. You have to remember and to follow a number of rules which were proposed by Viktor Boyko. The first one, learn to prove that child's interest and parents' interest are the priority for you. Think about everything what is happening during the treatment, putting yourself in the position of a patient. There is an idea. Do not treat others the way you don't want to be treated. Show trust to the parents and be the initiator of trustful relations. The fourth, communicate parents in a form of dialogue. Having an opportunity of a dialogue, a parent has an opportunity to specify some information, to express doubt, like letting his emotions out, which reduces significantly the grade of the conflict. So be constructive in the existing situation. Work the following way. Specifically formulate questions and arguments. Give the ideas in short sentences, 7 to 9 words. Suggest specific options of cure. Do not avoid complicated issues. Avoid medical terms which are not clear to the parents. Number 6. Avoid estimative communication. First of all, people do not like critics. They're negative towards critics. That's why we suggest, instead of blaming or just judging phrases, you should use complimentary phrases. For example, I thought you were a good girl and you would behave properly. This is just a judging one. Instead, it's better to say, you will behave well, you're a big girl, all right? Being in a conflict situation, instead of emotion, you switch on your brain. It helps you to move properly and to achieve initial results, proper results of communication. As soon as you feel the conflict is rising up, as soon as patients started to complain and to oppose himself to your activities, say calming phrase which plays the access key role to the mind of a parent. I perfectly understand you. If in this very situation this key does not work, we can use logical equivalence. I generally agree with you, but I share your point of view, nevertheless, and so on and so forth. With this introductory phrases, you're like putting yourself into the place of a parent. You watch it as with their eyes, and it settles the conflict between you. So after the communication, what should be the first visit? We spoke about the parents, what type of parents can be, and our relations with them. And we developed the rules of communicating with them. But what should we do if a conflict has ground into a complaint. Do not switch on temper. Do not lose your temper. Switch on your mind, switch off your emotions, be patient, zero conflict patience, and every success in our complicated work. Thank you so much.
Елена является еще раз
Thank you, Elena. Elena is a dentist. I say once again, a specialist with medical education, which works in dental clinic. Do you have any questions? Thank you. Now I would like to give the floor to the nurse of dental clinic number 32, Maria Bogdanova. Caries prevention. Role of a nurse for pencil with dental prosthesis. Caries is a disorder of dentin of the enamel of a tooth. More than 90% of all the inhabitants of our planet, regardless of their age, have caries, and bacteria which cause this disease is one of the reasons for that is the weak immune system. And dark enamel is the first sign of that. Caries provoking microorganism. Usually this is food, carbons, especially special place of the tooth, very comfortable for bacteria. In the oral cavity of a human there are many bacteria, and among them there are Streptococcus mutans, which causes caries, which causes demineralization of the surface of the tooth. Prevention of caries includes as factors as rational nutrition, health strengthening by general chewing and tolerate remedies. Dental prosthesis is not removable. Crowns, veneers, bridges, which are fixed on prosthesis. Prosthesis can be partial and full. After the prosthetic, the hygiene of the oral cavity is the key factor for maintaining this prosthesis for many years. You should clean the prosthesis from tartar. The rules of taking care of crowns. Metallic ceramic, the material doesn't matter actually. It's artificial materials which are not subject to cavities. Probably we cannot brush them very often. But that's not true. It can lead to inflammation of the gum. The cavities could also be at the root of a tooth. In spite of the hygiene, there are many rules. The first rule is to brush your teeth not less than 2 times a day, in the morning and in the evening. It's necessary to provide sweeping movements from the gum to the chewing surface of a tooth. You should remove tartar from all the surfaces, including all sides, and floss should be used to clean and irrigator. Brush should be replaced 1 time in 3 months. And the rules of taking care of removable prosthesis. After each meal, you should wash your prosthesis with water. For more efficient cleaning, you can use dental antiseptic solutions twice a day. You should brush the prosthesis and the paste. For prosthesis, it allows to remove tartar and the residuals of food. It should not be abrasive because it can leave fractures. There are means of personal hygiene of oral cavity, which can be mechanical and which can be chemical. Chemical means are divided by solid, gel, powders, paste, and liquid antiseptic solutions for mouth. Mechanic means are the toothbrushes, irrigators, and floss. Every 6 months you should visit a dentist for prevention visits, and the doctor will control the level of hygiene, can replace some defects of the teeth line. Also, you shall remove dental tartar, which is possible with professional hygiene. Horizontal technique is recommended when the instrument moves in parallel with the edge of the structure, with special curate like braces, for example. When you remove these impurities and this tartar, you should work very professionally, not to violate the adhesive connection. And to conclude, I would like to tell you that correct care of dental prophecies is a very important part of to improve their operation. Thank you for your attention. Maria, please stay. There is one question. Could you please tell me, what about training of patients? How to clean the prosthesis is responsibility of a doctor or a nurse? Both, nurse and the doctor. Both of them. Thank you very much. No more questions? Thank you for your attention. Our session is over. Thanks to our speakers and those of you who in your weekend time everybody was afraid that the dentistry section will not attract many people, but there are people who are interested in that. Thank you very much. Your applause, please. Let us give a round of applause to our moderators, Natalia Grebneva, Elena Kожевникова, Marat Akhmetov. Thank you very much. Dear colleagues, we have a small break, and at 5:30 we will meet here again to witness the next session, contemporary aspects of activities, of functions, of nurse in pediatric practices. I remind you that our assembly continues its work. If you did not visit our corners, exhibitions, interactive zones, let us do it right now. We have about 30 or 40 minutes to visit all our exhibition areas and to get acquainted with everything that's presented now on assembly.
Напоминаю, что мы вас ожидаем здесь.
Remind you that we meet here again at 5:20.